the situation that we find ourselves in is quite dire, and we've been talking about COVID-19 incessantly. We're still talking about COVID-19, and today we're going to be getting into that conversation a little further. One of my guests is in studio right now, Akwada. He's the Executive Director of Bureau of Public Safety. Good morning, Nanaya.
Good morning.
How are you doing?
I'm fine, thank you.
Fantastic. It's good to have you here.
Good.
How you doing with all the goings-on?
It's been stressful for us at the Bureau. It started about, I think, last Thursday. It's been back-to-back what our position was going to be.
Yeah.
Finally, on Sunday, we were able to come through with a decision, which we communicated to the government and to the public. So it's been, and the whole of yesterday, I was like, I'm a media man. It wasn't me alone, myself and the research director. We've been at it, trying to push our quest for a lockdown, through the media.
Okay, all right. We'll get into those stories soon. All right, so we're going to be discussing this morning basically the coronavirus pandemic. The cases have now reached 27 officially in Ghana. The death toll is 2. Of course, the Bureau of Public Safety, we're going to be discussing their call for a lockdown. Have they considered all the issues? What is the adverse effect of a lockdown on the country? If we don't do a lockdown, what are the likely scenarios that we're going to face? So we're going to be discussing all of that. And then, of course, we'll be also looking at the massive disinfection exercise of markets yesterday. And the fallout from that. Is that the end of it? Do we need to do more? Are we going to do this on a regular basis? And so on and so forth. So we'll be talking about all those things. But remember that the show is interactive. And so you kindly use the hashtag BreakfastDaily, and the WhatsApp line is on your screen, +233 5505 85832. So let us know what you're thinking, and we'll read your comments on air. All right, so let me get into the first story. I'll take it from citynewsroom.com, and I'll engage Nanaya in the conversation. All right, so let's read the first one. The confirmed COVID-19 cases in Ghana now 27. Death toll hits 2. Cases of the novel coronavirus in Ghana have hit 27, while the death toll has hit 2. The Ghana Health Service confirmed the new cases on its website. A total of 521 suspected patients, according to the Ghana Health Service, were tested for COVID-19 by Noguchi Memorial Institute for Medical Research and the Kumasi Center for Collaborative Research. Out of the suspected 27 cases, including 2 deaths, have been confirmed. All the 25 confirmed cases are receiving treatment in isolation, the statement added. The Ghana Health Service stated that among the confirmed cases, 20 are of Ghanaian nationality, majority of whom returned from affected countries. 7 are of other nationals, namely Norway, Lebanon, China, France, and the UK. In respect of contact tracing, a total of 598 contacts have been identified and are being tracked according to the service. One of the contacts developed symptoms and has been confirmed positive. 19 people have completed the 14 days of mandatory follow-up. The update from the Ghana Health Service, however, did not give out the identity of the country's second COVID-19 related death. All right. And then it goes on to talk about a patient who dies in Kumasi. It's a 61-year-old man. All right. So your thoughts generally on where we find ourselves with the 27 cases. 2 people have died out of it. What are your general thoughts?
Okay, well, basically, I think once the onset of once COVID was discovered here and it took a leap, or if you like, started coming up, we had very little to do than to put in measures to contain the spread. But majority of the cases were imported, and so it became a bit tricky. Elsewhere, they deployed technology in monitoring people who came in, aside human resource. We do not have both. The human resources is challenged.
But we're using the temperature screens.
Yeah, but that's just at the point of entry. Okay. I'm talking of after they have entered.
Okay.
So we had no means whatsoever to monitor these people apart from phone calls and checking up on them, whether they were actually complying to advice to self-isolate or not. We had no means to monitor that. Whereas elsewhere, I was reading on my way here, Moscow has deployed over 100,000 cameras, to monitor not just patients, but people suspected of having, the condition. We had no such means at all. And so we knew that somehow the numbers were going to go up. Of course, it was also predicted by the experts that the numbers were going to go up. In fact, at the time when Ghana had 0 cases, our experts, our technical leads, were still in doubt. And at some point in one of the meetings, one of the doctors had to question that he's not sure what measures or how the efficacy of the testing process. Some of us had to just challenge it and say, look, it's a system. We needed to trust the system. Ironically, the following day, just a day after that meeting, we announced our first 2 cases. And then the I told you so's began. So they are predicting that the cases are going to go up and that actions that government is taking is good, but not enough. It's good, but not enough. So the cases will continue to rise. We are also seeing an emerging trend that several institutions now calling for a lockdown. We made our call on Sunday. We've seen since then, we've seen TUC on board. We see some persons, I don't know if it's Noguchi as an institution, but some persons from Noguchi also calling for a lockdown. Of course, the politicians are also joining in the call for the lockdown. But it appears as if government is still hesitant. And so what we are seeing, an emerging trend now, is that institutions are taking that decision for government, and that is dangerous. It's
how so? What do you mean?
Well,
taking a decision
I just this morning I've picked news, suggesting that the Public Services Commission, I'm not too sure of the designation, is calling for institutions to let non-essential staff stay home and then make some schedules flexible. The Ghana Tourism Authority is calling for beaches to be closed. The Ghana MTTD of the Ghana Police Service is pulling its men off the street. What are we going into? And even for the MTTD, I think is most unfortunate because that should never be. So if the government does not coordinate these institutions and make decisions that will benefit the populace, various institutions are going to drive the country into a lockdown, an uncoordinated lockdown, and that can be very, very disastrous, probably even more disastrous than the COVID-19 itself.
But don't you appreciate the government's position in being hesitant
to
lockdown?
It. I can't. I just can't appreciate it. What are the reasons for not enforcing a lockdown now?
The economic reasons.
So those economic reasons over 2 regions, do you think if we allow this to persist and there is a spread across the 16 regions, can the government lock down? Those economic reasons will not go away. So you are better off locking down when the disease is discovered or is prevalent in 2 regions and deal with the consequences.
So this morning alone, for example, there are vehicles, trucks, buses from places as far as Tapwa, Abotrase, bringing in
Abotrase, that's my area. That's my hometown.
Bringing in goods, fish, and all that to the markets right here in Adabraka, right? When you lock down, it's going to be challenging in terms of food, because look, yesterday I was surprised that when the markets were closed, right, it affected the movement of public transportation. It affected. Listen, there was no traffic in town anywhere. The number of people had reduced off the streets. It's almost like the market is a center, the fulcrum of activity. So when you lock down, and I'm not saying either this or that, I'm just asking us to see, are there not other challenges, and that's why the government is hesitant?
Well, unfortunately, I have to draw you back.
Okay.
You see, the situation we are in, I really would not want to say it's an either-or situation, but that's what it is.
Okay.
We are caught between the devil and the deep blue sea, or a rock and a hard place. We must make a decision. When we called for a discriminated lockdown, we were careful to put in there that essential services must be allowed to operate. And essential services in our circumstance must be redefined. Essential services is universally defined, but we will have to redefine it. So why? When you lock down, we are not at war. If we are at war, we are at war with the new coronavirus. Yeah. So you lock down, essential services could be people supplying good foods. Okay, food, grocery, as we call it, grocery. Yeah. So if we give some dispensation to people who are supplying grocery, that people can move out to go and make grocery shopping, items like cosmetics.
But if you're on a lockdown, how do people move out to go and do grocery shopping? Because you're on lockdown.
Yes, you're on lockdown, but
so you're locking down the city.
No, that's a misunderstanding of a lockdown.
Okay.
You can't have a lockdown and allow aspects of the economy to function.
To still function. Okay.
This morning, UK just went into a lockdown. They are allowing people to even come out and exercise. Okay. So lockdowns must be defined. Doesn't necessarily mean nobody moves an inch. So we are saying that when there's a lockdown, the police are working. National Fire Service is working, ambulance is working, the hospitals are working, pharmacy shops are working. The markets are working, but the markets
the media
working.
Will be working.
Of course. The markets working, probably I wouldn't be sitting here probably in a lockdown. The markets working must be restricted to just foods. Food, I mean, and not cosmetics, not any other thing. So that is a measured lockdown. And we can do that. If we fail to do that at this stage where we are dealing with the numbers under the hundreds, what we are doing is that this morning you open all of us. We are all out there. I wash my hands before coming in here, but my hands has been in my pocket for a while before washing my hands. My hands go back into my pocket. I'm leaving this desk. God knows what I'm depositing here. And someone else is coming back to come and take his chair here. So when you leave us out there, we have all, I'm coming from La Paz, someone is coming from Pokwase, Ebri. We are all converging at one workplace, Citi TV offices. I use the restroom, you use the restroom. So I pick it from here, I take to Pokwase. Someone else picks it from here, takes it to La Paz, Tema, and we keep spreading. So once we keep spreading, it's going to make the management of the infections itself very cumbersome, and we'll almost lose it. So now that it's just in 2 regions, we are better off going the hard way, locking down, keeping people in their spaces for 21 days or more, by which time we believe that the virus would have gone through a 2-cycle gestation period. We will know who has it, who does not have it, which household is in danger, which household is not in danger. It's easier to deal with it in cluster than it dispersed.
Okay, thank you very much for that. I want to introduce my other guests to you, and then we'll continue. Safia Abdallah Raabo. She's an epidemiologist, and the executive director at Zongo Girls for Education. Good morning. How are you? All right. So you study the spread of disease.
Exactly.
That's what you do. Fantastic. So your initial first comments, we'll go for a quick break and then we'll come back and continue. So what are your thoughts right now? We've reached 27 COVID-19 cases. 2 people have passed on. Rest their souls. So what do you make of where we find ourselves?
Okay. To add to what my brother kept saying, yeah. And I think the spread is exponential. Yes. So a lockdown is not out of place as at this moment because the spread is exponential. It's not like it's an addition. It's actually an exponential spread. So 3 people get it. The next spread is going to 9, then to 27, then it increases. So at this point, I think we should be able to put in place measures to contain it. And then from the public health perspective, the measures we put in place has to be adjusted per what is happening around us.
Yeah.
Yes. So when you look at what is happening in other countries, even countries that have not recorded as many cases as Ghana are putting in lockdown measures. So I think it's not out of context as of now, yes, in order to contain the virus and then curtail the horizontal transmission. I think it's prudent for us to.
Well, I mean, I don't want to belittle the seriousness of the situation, but we haven't hit the exponential part of the curve yet. You're saying that we should lock down before we hit the exponential part of the.
We have actually. Yeah.
No, I said the spread.
We have
the spread,
have
and
we?
we've actually
Yes, we have.
But if you look at the numbers,
well, where did we start from? 2, and then. Did we go to 3?
2, we went to 6.
Good. From 6, did we go to 7?
6, we went to
9.
7,
so
and then 9,
so
11.
But it confirms what the WHO, that's exponential.
Yeah.
The WHO, look at
it's not
common
addition.
flu. It's you can transmit to one person at a time. This one, per the WHO assessment, you give to 2.6 persons. So we are talking 3. For each infection is transmissible to 3 people. That's very, very potent virus. So it's not something that we can joke with. So we will probably not be moving from 27 to 28. We might probably be going to 33 or 35.
And we might not also want to see what has happened in Italy, happen in Ghana.
No, for sure. That one we don't want to see that anyway. Anyway, so let's take a short break. We'll be right back and continue the conversation. All right, welcome back from that break. Remember, the hashtag is BreakfastDaily, and the WhatsApp line is 0550585832. We are live on DSTV, and so if you happen to be watching us outside Ghana, kindly use the hashtag, the country code +233. All right, so we've been talking COVID-19, and we're still going to delve in a little further. My guests are Akwada of the Bureau of Public Safety, and then Safia Abdallah Raabo. She's an epidemiologist and the executive director of Zongo Girls for Education. Now, I'm going to go to her in just a second, but I want to read something really quick. The Bureau of Public Safety has called for a lockdown, and I want to and the other institutions are also calling for a lockdown as well. The Bureau of Public Safety has called for the immediate discriminated lockdown of Greater Accra and Ashanti regions for at least 21 days. The Bureau has also called for a lockdown of all ministries, departments, and agencies, and all metropolitan, municipal, and district assemblies. It added that the essential services could be exempted from this lockdown. In the urge to the government, the Bureau also called on the President to draw lessons from countries such as China, Italy, etc., which have been hit hard by the pandemic, and timely actions of Rwanda, which has fewer cases, yet has taken that bold decision to lock down. All right, so help us to understand what's going on in terms of the spread. Okay. The numbers we are seeing, what's the potential danger involved? You're an epidemiologist, so clearly you see things from a different perspective. Help us to understand, our viewers to understand what's going on here, and why, if at all, is it so necessary for us to have a lockdown?
Okay, in the Ghana context, when you look at how our cases started, we started with just a few.
Two initially.
Yeah.
First was announced
yes,
2.
And then within 10 days, we are now around 25.
Yes.
So, and then by 2 weeks' time, we are expecting to see a high number. Because even currently, we are contact tracing around 598 people, which is huge. Yes, so we are increasing. I mean, it wouldn't come down. Yes, looking at the number of contacts and then monitoring of the contacts, it's not so effective as well. So the next 2 weeks is going to be very critical for us if we don't put in the right measures.
The next 2 weeks?
Yes, okay. The next 2 weeks is going to be very critical. And then with that too, some people are asymptomatic. They are not showing signs and symptoms. And then with the currents, we only test those who are showing signs and symptoms. So we don't know who has it, but it's not showing signs and symptoms, and then the person keeps moving. And then there are no restriction on inter-regional travel. So we are going in and out, Accra, Kumasi, northern region. We are just moving about. So it's going to increase. Yes.
So what you're saying is that because people can spread it without showing symptoms, it's important for us to limit the movement of people.
Exactly. We have to put in the aggressive measures right now, contain the virus. We will be knocked down. Economically, it wouldn't be easy. But then after that, we go back to our lives, suffer the hardship for a month or two, then we kickstart our lives again. It's better than to wait and then have it all around, spread all over around other regions that don't even have isolation centers. Then now the system is overwhelmed. Our health system already is not well equipped for in the case of an overwhelming situation. Yes, so we have to do the right thing. And then I think this is the time. Yes, we don't have to wait till we get to the 50s and then the 60s before we start actually looking out for measures to contain the virus. Yes.
So looking at the numbers, I'm just thinking to myself, on the 12th of March, I think we recorded our first, and then today we're talking about 24th. So in 12 days, we've gone from 2 to 27. Does that, how much worry does that give you?
A lot of worry, actually. A lot of worry. Because yesterday when I saw the number, I was like, but I'm not so surprised, because as a public health practitioner, I know it's to be anticipated. This is a virus that is spread by contact and then unhygienic stuff. So you don't know whom you are meeting. You can even meet someone you so trust, but then the person has it, but it's not showing signs and symptoms. Then you carry it on. You also go back to your home. Then you move on, because currently we are not doing mass testing. So we don't know who is positive and then who is negative. So it keeps spreading, and then it's alarming. It's alarming, actually.
All right. You've been sending us messages, and I just want to read quickly here. Mama G from Kaswa says, the government is doing all its possible best to fight coronavirus. I think it's time we all go on lockdown before we have to cry out aloud. The billionaires in Ghana should help the government with simple kits to fight the virus. Is there such a thing that exists? Simple kits? Okay.
Test kits.
I guess maybe it's test kits, and then also the masks and so on. In their small ways, they should help the communities they are living in with sanitizers and masks to help fight against the virus. The Lord is our strength, we shall overcome. All right. And then another person asks, how do we survive if we go under lockdown? I want to ask you that question. How do we survive if we go under lockdown? I mean, and I tried to explain a few minutes ago that a lockdown is not necessarily stay in your house and don't move out.
Yeah.
You know, so I think that's part of the concern. Yeah. That what does it mean when we say a lockdown? Yeah. You know, so how would you answer that question? How do we survive if we go under lockdown?
Okay, so to start with, I would say human lives are more important from the public health view. We are interested in saving lives, and then the economic burden will come. But then I think that's where government has to come in as well. And then especially not even looking at it from the view of the high class, but the vulnerable groups. Yes, so I think there should be social packages for such groups of people, because if not, you can't get them to lockdown. No, they have to go out there and then source for their livelihood. Yeah. So it has to be drastic, and then the government has to step in and then provide some sort of packages for people just to be able to get them to stay at home. Yeah. So I think what other countries are doing, we can learn from it. Maybe utility for free for maybe the first months of lockdown. Okay. Yes. Okay. So those are the measures that can be put in place so that we can
that makes a lot of sense, actually. Yeah.
Stay at home and then.
So Kamal Abdul Mumini says, I want to bring two issues to your attention. He says, I want you to use your platform to say that our borders in Boko, he mentions specifically Mognori and Kulungungu, are very porous, as people, especially coming from Burkina Faso through the Mognori barrier, just cross into Ghana unchecked. However, as we stood watching the other end of the Burkina Faso border, we see their security officers whipping and chasing people back to Ghana. All right. Nanaya, I would like you to comment on this when I'm done. There's a second part. He says, I traveled to Navrongo in the last 2 days, and I see our security officers without protective tools, health workers too, drivers not wearing any nose masks, as well as no hand sanitizers for the passengers to use to rub their hands. Additionally, hand sanitizers are scarce in Boku to buy where they are. It's also expensive.
Well, that's unfortunate.
I thought on Sunday, all our borders and ports were supposed to be shut.
Yeah, it is shut. I believe, government, that it is shut. If you understand the, is it topography or the plan of our borders, there are people who sleep in Ghana and technically bath and brush their teeth in the neighboring countries. So we don't have very defined borders, with our neighbors. And so some of these things are to be expected. In fact, there are aspects of Togo, technical Togo, that accept cities, and there are aspects of technical Ghana that accept. So these people are, if you like, privileged to be living in two economies. So that would be very difficult to comment or make any emphatic statement on.
But on the other side, on the Burkina side, apparently they are whipping people
at the border, at the designated border.
Yes.
But I'm talking about
the other spaces
border,
along
the spaces that are not policed.
Okay.
So, but the part that scares me most is the soldiers or whatever chasing people into Ghana. That is a not. That may sometimes be considered an act of war, because if no matter what I have done as a criminal in Ghana, the moment I cross the line from Ghana to Togo, even if I, God forbid, I assassinated your president, your soldiers or military cannot follow me into Togo unless they start a whole new process through Interpol or whatever. So that should not be, and maybe the soldiers don't understand.
Well, basically what he's saying is that it looks like Ghanaians or maybe Burkinabés who are returning to Burkina Faso, once they get onto the other side, there's a no man's land zone, right? So once they cross over and they're getting into the Burkina side, they are returning them back and saying, no, you can't come into the country, you can't come into Burkina Faso.
Well, if they are Burkinabés, they must be accepted in their country. I've not seen any country that's not accepting.
Shouldn't we shouldn't we have as stringent a policy that nobody leaves, even especially at our border? You see, because what he's saying here clearly is that this is actually the official border. It's not a bush route. It's an official border, right? And he's saying that people are actually going out. How are people going out to Burkina Faso?
Well, if they are Burkinabés, they are allowed to go out. When we say our borders are closed, doesn't mean no one goes, no one comes. If you want to go to your home, you must be allowed to go. These things are governed by international conventions and practices. You can't hold someone in your country, especially if the person has not violated any rule. So when the president announced closure, I did not hear him say you can't go out. He says that our borders are closed to foreigners, and that when foreigners come, they will be turned back. When citizens come in, they will be mandatorily quarantined. So when we say the borders are closed, it does not mean that it's closed, no one goes, no one comes. There will be some limited movements.
Okay.
But if we pursue this, we will veer away from COVID-19. So I just want to read for you a communique from the South African president to South Africans, I think yesterday, detailing their lockdown, just a few lines.
Yeah, okay.
He said from midnight on Thursday, 26 March, until midnight on Thursday, 16 April, all South Africans will have to stay at home. That's the first bulletin. The second one is the categories of people who will be exempted from this lockdown are the following: health workers in the public and private sectors, emergency personnel, those in security services such as the police, traffic officers, military personnel, soldiers, etc. It will also include those involved in production, distribution, and supply of food and basic goods, essential banking service, the maintenance of power, water, and telecommunication services, laboratory service, and the provision of medical and hygiene products. You understand? So when we say we want to go into lockdown, we want the president to be able to look us in the face and say, every Ghanaian stay home. These are the persons we want to let go out to go and do, to go and provide for the country. In this one, Ramaphosa indicates it. Temporary shelters. Individuals will not be allowed to leave their homes except under strictly controlled circumstances, such as to seek medical care, buy food, medicine, and other supplies, or collect a social grant. Temporary shelters that meet the necessary hygiene standards will be identified for homeless people. Sites are also being blah, 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 So when we call for a lockdown, this is the character of what we are calling for. And failure to do this morning, there are people who someone just got up and is just loitering on an Kwaku saying, we should be able to put in stringent measures. And I'm saying that lockdown is not, I'm yet to see any head of state announcing a lockdown and in a happy mood. They all do it. You see, they are sad. Because it has, apart from the economic and social consequences, it may have your political opponent can even exploit it to get mileage. So it's not a pleasant place to be. But the alternative is more devastation.
So let me quickly get into the last bit of the morning's stories. Yesterday, there was a massive disinfection exercise in Accra. Let me read the story quickly from there, and then we'll continue. All right. So, I don't have that here. Did you follow the market disinfection?
Yeah, somehow.
All right. So let me just quickly read that. Coronavirus disinfection of markets in Accra was successful. This is from the regional minister. And he says here, the Greater Accra regional minister, Ishmael Ashite, says the disinfection exercise conducted in the various markets in the region was successful. A number of markets in the Greater Accra region were on Monday, 23rd March 2020, disinfected by a team of sprayers as part of efforts to curb the spread of the novel coronavirus in the country. Speaking on Eyewitness News, the regional minister said that the exercise achieved its targets. They were led by Zoom Lion Ghana Limited, who are the actual operators who disinfected about 141 markets in Accra. I went to Ashaiman, and I went to 2 markets, and I think it was a very successful exercise. It was our intention to disinfect the markets, and we did just that. So it was a successful exercise. Excuse me. He goes on to say, not only the coronavirus, because there are other illnesses that we can get from the markets. And when we went to the markets, we saw how unhygienic those places were. Viruses, germs thrive in places that are dirty. All right. So is it enough?
Yeah. Well, yeah, I wish it were enough. I wish it were enough, but I also don't want to believe that our markets were fumigated because of coronavirus, or we disinfected the market of coronavirus. I have not heard any government official say so, and I wouldn't want us to propagate so. The fact is, I was giving you my phone.
Yeah,
these are footages I took as far back as 3rd November 2019. Okay, our markets are appalling. I mean, if you go to the market on a busy day, I didn't take these footages, or we didn't take these footages when the market had closed or anything. It was on a busy day. The rodents were just also shopping with us. And in this footage, yes, rats, cockroaches, I nearly said tefre, cockroaches, they are all there, moving freely in our market. So this infestation program is good. What we want to see is that it should be done more regularly. Those of us who are employed in other institutions, sometimes for some facilities to be allowed to be given the license to operate, you must provide fumigation certificates.
Yeah.
So we are forced to get people to come and fumigate our premises, obtain certificates from them, to file for licenses to operate. Okay. Why can't the state do that for the markets?
For the markets, yeah.
Because you go there, you take toll, and if I knew this was going to come up, I would have begged your producer, giving him the footages to show for Ghanaians to see. You see rats, whether they are kusi or whatever, in the market, moving freely. Some of them, you can even use your leg to pet them. They won't run away.
Wow. So they're so used to human beings that
is so serious.
They're comfortable
it's so serious. We shouldn't be doing this to ourselves. So the fumigation of the market is good. We look forward that the exercise should immediately, replicate across the rest of the markets in the country.
Yeah, I think he mentioned that that's the plan. Obi Amwa mentioned that it's supposed to be a nationwide. So what is your take on it, considering your angle, your perspective on diseases and a disease spread? Of course, every year we have issues with cholera, and other diseases and so on. And it's almost like it doesn't make any sense. We keep repeating the same cycle over again. What do you think of what happened yesterday with the markets?
I think it was a very laudable approach, to disinfect our markets, because, like you said, cholera outbreaks and other stuffs, the market women, even the things they do around the markets, and then the the things that happen is not, and then that's where we always shop, and then we get our foodstuffs from. So I also don't want to link it with COVID-19, because I don't really.
Why not?
I don't really see the link, because viruses don't thrive under that condition. Maybe other stuffs. Yes. So this is something that should have been happening. So it is good. Maybe because of COVID-19 we did it. But then there are other avenues, modes of transmission, that we have to pay critical attention to. Yes. But this is a good thing. Yeah, it's a good thing. And then we could do it intermittently. But the major thing I think we need as a country, and then where the gap is public education. Public education, I think, is lacking. Yesterday, I saw a video that was put online. Those people that were quarantined, coming from outside, I think there should be continuous education, because currently some of them don't even understand why they are quarantined. You understand? And then I'm sure by now they are calling their family members, come and visit me, something. We don't even know what's happening because they don't have the adequate information. And then there's so much stigma around COVID-19 and everybody is afraid. It's like when you get it, you've got a plague, which shouldn't be the case. Because most people actually present with mild symptoms. Yes, so for the severely ill and then those with underlying condition, those are the people that might die from COVID-19. But then we are making a public appeal, especially to the youth, to socially distance and then limit their movement, because it's like we are serving as each other's keepers in this situation. Yes, you might not know.
I've noticed that a lot of people, especially the young people, have this mindset that even if I get it, nothing's going to happen to me. But what they don't realize is that if you get it, you may pass it on to your parents.
Parents, exactly.
You know, and that's where the problem will come from. You know, so
and then or someone with an underlying medical condition already, and then it comes. So I think the public education has to be continuous, and then it has to be intensified as well. And then so those back home, those who are in areas that is hard to reach, and then based on information and all aspects, we should get a way to let them understand what is happening, and then make sure that the right information gets to them at the right time, so that they will know what is happening. Because believe you me, quarantining is not easy for some people. Some people cannot quarantine, because some of them, 6 people are sharing a room. I don't know how such an individual will quarantine if he happens to be a suspected case for COVID-19. Then it will be disastrous. So those people need to get the information in time, and then start practicing the prevention and then control measures, washing their hands, socially distancing, and then doing the needful, avoiding contact. Handshaking is still going on where some of us are from. The handshaking continues. Zongo communities, I mean, behavioral change is difficult, but then we have to instill that discipline in us for this period. I mean, we can go back to our lives after the whole COVID-19 is past.
Now, talking about Zongo communities, a project that you're working on. Can you tell us a little bit about that?
Yes, so we are working with the Office of the Chief Imam and then other renowned Muslims to target our Zongos. Because believe you me, everybody knows what happens in Zongos. And then looking at our settlements and other stuffs, if I'm not praying for that. If COVID-19 gets to Zongo, it will be disastrous. Yes, quarantining is not possible unless we get separate quarantining centers. Then we move the people to that place. Because some people are as many as 6 sharing a room. It's not adequate. And then per our practices, like performing ablution per se. WHO guidelines tells us not to touch our face, not to put our hands in our nostrils. But as Muslims, when we are performing ablution, we do that. And we do it frequently, like as many as 5 times in a day. And then it's not the normal practice for us to wash with soap before we do ablution, because we assume that we are clean, because we are doing it frequently. So that's what we want to propagate out there, put it out there today.
How has the reception been so far?
Yeah, because it's a gap, and then we know it's a gap, so it's been well received. And then it's behavioral change, like I said. It's not going to be easy, yes. But then, from the public health view, even if one person changes his attitude after our campaign, I mean, it's a good thing. So we are hoping that collectively we can come together and then make the difference, and then have a zero COVID-19 issues in our Zongos and our Muslim communities.
Thank you very much. Thank you very much, Safia. Just quickly read a few more messages. You've been sending so many messages. Please inform the government to take measures to consider those in remote places. Someone says here, please, the attention is only in Accra and Kumasi, forgetting that people travel to other regions to trade. Okay. Ghanaians should also abide by the rules in Isaiah 26, verse 20. All right. Degura Benitos says, from Nandom, says, good morning. My major concern is the citizenry that wear hand gloves around, and more importantly, the bankers that wear hand gloves whilst receiving and giving out money to their customers, because we all know that this is one way of spreading the infections fast to the populace through the exchange of money between individuals for goods and services. Hence, technically, those various individuals should advise themselves out of that behavior. The best way to do this, the practice properly, is to practice hand hygiene, such as proper hand washing and proper sanitizing of your hands. All right. I think that there tends to be a bit of a maybe misconception wearing hand gloves, because yes, you're not getting your hands contaminated, but if you are infected, you're passing the infection on. Yeah. So I think that's... Anyway, a couple more messages before we go. A.U. Farouk from Tamale North says, good morning to you all. Only Allah can save us from this deadly COVID-19. It's COVID-19. Basically, we don't necessarily add deadly to it, even though some people do die from it. The statistics all show that more than 80% of people who get it actually survive. So we should keep that in mind. We should all follow the measures given by health experts. Thank you very much for that. And finally, the disinfection of our markets, places by government, was a great move worth applauding. But still, let's continue to comply with safety precautionary measures and directives by the state. Ghana shall overcome this one too. All right. Thank you very much. This is from Sir Ewuku in Esoboy. Well, thank you very much for watching this segment of the show. This has been News Review. My guests were Safia, Raabo. She's with the Zongo Girls Education. And also to Nana Akwada, who is with the Bureau for Public Safety. Thank you very much for joining me. And thank you for watching.
Hi, I hope you enjoyed the show. Do not forget to subscribe, like, comment, and share with your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.